What would you like to say to a dentist that hasn't tried Activa yet and that maybe is on the fence about trying it? They're really not sure if they should. What is something you would like to share with them to encourage them to try Activa?
If some of my colleagues span world, they have not yet used Activa, I would go and say, first thing, what are you using now? Okay, then my second question to them is, how often do you change your cell phones? You change it every year practically whenever a new model comes.
Yes.
You don't think about what it is doing, though it is doing the same thing. It's catching pictures, it's making you talk, it's making you this and making you that, but you still change. Why?
Right.
Because you're passionate about that. So if this is my profession, and my profession is only till here, maxilla to mandible, till a little bit beyond the neck, why won't I use something which I can give back the patient and easy to use as a dentist? Let's talk about my point of view. You know, when I'm in my clinic, half of me, I'm a dentist, trying to work with the best of materials, and this half of me is the administrator. Hey, how much should I use? Is it going to cost me more? But when I work it out, it's easy to use, it is giving back what I want to the patient, plus it is so less time consuming, and if I compare to the current materials I'm using, it's actually more cost effective for me.
Wow.
So why wouldn't I?
Right.
And why wouldn't you? That is my statement to them.